Hello, everybody, and happy World Obesity Day, March 4th. For most of you, I believe in Australia, we are starting to have March 5th. I'm Johanna Ralston, and I'm CEO of the World Obesity Federation. It's my great pleasure to welcome you today to the World Obesity Federation, World Health Organization, and UNICEF webinar on 8 billion reasons to act on obesity. This is the Global Obesity Coalition formed 5 years ago now on World Obesity Day to bring together these global organizations to coordinate action and accelerate prioritization of obesity. We have a fantastic webinar and we have lots to do, and we have a great group of people speaking today. So I want to let you know a little bit about why we have this 8 billion theme this year. We know new data are showing that soon there will be 4 billion people living with overweight and obesity around the world. We'd been focusing really on that half the world, but then recognize, thanks to actually Pau Gasol, one of our champions, a childhood obesity leader, that it's really about 8 billion people. It's about all of us. We all have a role to play. We all have a part to play in addressing obesity, and we all have reasons. Many of you have come back to us and posted your own reasons for why it's so important to you to address obesity. Together, we can get so much done, and we've been starting to see wonderful progress. But we also have great challenges, as today's World Obesity Atlas shows, which is focused on childhood obesity. And we'll be hearing a great deal about that as well. So it's really my great pleasure to start the webinar and to tell you a little bit more about the speakers today. We will have the Atlas presentation first, and then we'll have a panel with experts from the World Health Organization, UNICEF, and from Chile. Government speakers from Brazil, Egypt, and Brunei, all countries that are doing great work in the WHO Acceleration Plan. Civil society speakers, advocates, and others from South Korea, Slovenia, and the US. And then closing remarks from the World Obesity Federation president, Simon Barquera, who will be calling in from Mexico. Please, a reminder that questions for speakers should be posted in the Q&A box. And please do specify who the questions are for. Our wonderful WAF team will be trying to answer them in real time. If there are questions that require further research or investigation, we will follow up and we will be sharing the slides from this webinar as well. Please do introduce yourselves in the chat today and share your reason for acting on obesity so that we can capture that, get to know you a little bit better. And thank you for being here. I'll also note that I will be moderating the first half of the webinar, and the second half will be moderated by Maggie Wetzel, who is our head of policy and advocacy. So first, it is my great pleasure to introduce our World Obesity Day video.
There are 8 billion reasons to act on obesity. Today, more than 1 billion people are living with overweight or obesity. And by 2035, that number could rise to 4 billion. That's nearly half of the global population. The hard truth is that this affects us all. And the story starts early. Childhood obesity is rising fast, jumping from 4% in 1975 to over 20% today. And the steepest rise is being seen in low and middle-income countries, which is widening global inequality. Many children are already showing early signs of diabetes, heart disease, and other chronic conditions that will follow them into adulthood. But these outcomes aren't inevitable. Together, we can change this story. On World Obesity Day 2026, we can all ask ourselves what we can do to address obesity in our communities, whether that means challenging weight-based stigma, supporting health-promoting activities, or writing to policymakers to demand system-level change. Doing so, we can ensure that children get the fair start they deserve. Obesity is recognized as a complex chronic disease, and for all 8 billion of us, it means a healthier world. This World Obesity Day and beyond, there are 8 billion reasons to act on obesity. Share your reason.
Wonderful video, and thank you so much for that. I hope that you were inspired and galvanized by that to share your reason in the chat. Again, 8 billion reasons, and we have quite a big group here today, so we're really excited to hear your reasons. I'm now going to tell you about the World Obesity Atlas, which we produce every year. This year we have focused it on childhood obesity, and as you heard in the video, Some of the data are incredibly alarming in terms of the impact on children of early overweight and obesity, and they are now presenting with the types of conditions that used to be associated with sort of older adults. So it is heartbreaking, alarming, and yet there's a lot we can do. We're looking at projections, and projections are not destiny. They are a direction that we're headed if we don't intervene, and there is so much that we can be doing together. So it's my great pleasure to introduce the author of the Atlas, Dr. Tim Lobstein. He's a senior policy advisor to World Obesity Federation, having retired as the organization's director of policy in 2020. He's also an honorary senior research fellow at Imperial College London and a visiting professor at the Bowden Initiative at the University of Sydney in Australia. He was the first recipient of the WPT James Award at the International Congress of Obesity, which recognized his outstanding contributions to obesity epidemiology and population medicine, including establishing the Global Obesity Observatory at World Obesity Federation, and this serves as the foundation of our data. So, with no further ado, Tim.
Thank you, Johanna. You've painted me as much more than I feel I am. But also, the Atlas is a joint project. Although I provided some of the base data and helped steer its sort of content and structure, it's a team effort, not just me. Okay, Holly, next slide, please. Okay, so this, as Johanna said, is a focus on obesity in childhood. And if you haven't had a chance to look at the Atlas yet, which isn't surprising because it's only launched today, it will show you the numbers affected, the trends projected through to 2040. As Johanna says, this is only if nothing is done, based on trends of the last 10, 15 years. It also talks about the early signs of heart disease, stroke, diabetes, and liver disease, which are affecting children with overweight and obesity. Includes estimates of the exposure children have to obesity risk factors. I'll come talk a little bit more about that in a moment. And also the national policies that are underway to reduce risk, which countries are doing it and which aren't. And lastly, the Atlas is stuffed with 196 national scorecards, showing much of this data broken down country by country. Holly, next. Okay, the headline finding, as we saw in the video, really, is that more than 180 countries have seen a rise in overweight and obesity prevalence amongst children since 2010. That's right against the WHO targets at the time, which were to hold obesity at those levels. That's failing in 180 countries. And globally, more than 1 in 5 school children, that at the moment ticks up at about 420 million children, are experiencing overweight or obesity. And this is expected to pass 500 million children before 2040, unless action is taken. Now, this isn't evenly spread across the world's population. Holly, next. If we look at the distribution according to income levels, as was mentioned, there is a wide distribution. And what's more, the upper middle income, lower middle income countries are showing by far the most rapid increases in the numbers of children affected. And as you can see, high-income countries have actually remained remarkably stable over the years, whereas the rapid increase, that line up the middle is where we are now, rapid increase is expected to accumulate even higher over the next decade. Now, you might say, well, that's just because the population is increasing. It isn't just that. The actual prevalence of obesity and overweight amongst children is also increasing in the upper middle income countries, especially. Indeed, by about 2030, the prevalence in upper middle income countries is likely to exceed the prevalence in high income countries, where we have long assumed most children are most exposed. So upper middle income countries, you have a problem. And by 2040, as many as 40% of your children, school-age children, are likely to be affected by overweight or obesity. And that doesn't just mean a problem as they head into adulthood. Yes, thank you, Holly, please. Not just a problem in adulthood, thank you. It also is a problem already in childhood. So we have estimates for the numbers of children who would be affected if they were in a healthy population, and the additional cases that are arising due to their overweight or obesity. So for pre-diabetes, it's actually quite common amongst children at all weights, but especially amongst those with a higher BMI. So that adds the 14 million children are likely to be suffering from pre-diabetes right now due to their excess body weight. Cardiovascular indicators, that's 47 million excess. Hypertension, high blood pressure, that's 34 million children excess due to their high BMI. And early liver disease, which really is linked very closely to body mass index, 98 million children are modeled to be currently experiencing. And one of the things about these diseases or early indicators of disease is that unless you monitor, you don't know it's there. Hypertension, almost invisible. Early liver disease, not noticed, and so on. So until you monitor these things, you aren't aware that these diseases are beginning to develop. Holly, next slide, please. Okay, we also look at exposure, and we do a number of maps talking about various different aspects of risk factors that are raising the risk of obesity in children and need to be attended to. So it's diabetes amongst childbearing age women, it's consumption of sugar-sweetened beverages, it's infant feeding practices, and so on, physical activity and so on. So there are several maps that need to be looked at carefully, and you can see how your country is doing compared with others. Next slide. We also look at the policies that are currently in action or likely to be in action. So which of the countries actually is implementing the Code of Marketing of Breast Milk Substitutes, for example? Which country has physical activity policies in place? And so on. So we look at a number of issues there: marketing to children, sugar taxation, labeling, and so on. The maps are in the atlas. I encourage you to have a look. Next slide, please. Okay, one of the issues that is obviously coming up is actually the data is pretty skimpy, and we've had to model or use other people's modeling of what is going on to try and get these complete maps. When we looked at where data is coming from, a number of countries simply are not monitoring even the simplest of nutritional status amongst school-aged children. So a number of countries haven't modeled it haven't done any surveys for the last 30 years. Several countries have only done one or two in that period. So routine surveillance of children's nutrition status is simply not happening in a large number of countries, and we're having to make estimates of what is going on. And we really need to improve on that. And that would apply also to the services available. We don't know really what services children are likely to have access to if they are beginning to show signs of obesity or the consequences of obesity. Lastly, next slide, please. Lastly, as I said, at the back of the atlas, in fact, taking up a large proportion of it, are country by country records of how they're doing. This is the modeling for each country for the trends in obesity levels, the numbers of children likely to be suffering from early indicators of disease, the various exposure risks, and the policy actions that are there. I think, given the limited time, I'll encourage you to go and have a look. Next slide, please. At the database that we have and where the atlas should be stored now, and previous atlases too, which have all featured various interesting issues about how obesity is affecting the world's population. So please visit the database there, the Global Obesity Observatory, and thank you very much for the opportunity to present the atlas. Johanna, back to you.
Okay, thank you, Tim. I just want to, first of all, thank you again, Tim. This has been great work. And yes, it was a group effort with lots of trusted advisors as well reviewing this. But I want to thank you very much for what I consider actually a shocking report. I really do. And I live and breathe this data. And yet I'm shocked when we really start to put it together that again, children are showing signs of diseases that used to be limited to much older adults, and that again, liver disease, not just prediabetes anymore, not to diminish the the impact of that as well, but diabetes, cardiovascular issues, and liver disease. It really shows that that what we've done so far has not been enough. We have actually failed. We can point fingers at others, but it's a collective societal failure because we've not treated it as a societal issue. And I think that this is really a clarion call to move beyond sort of childhood versus adult obesity, prevention versus treatment, to a holistic integrated approach, and to really, really, really galvanize support for measures that we know are effective, that Tim noted, in terms of countries that do various interventions around sort of front of pack labeling and breastfeeding and so forth. So it's now my great pleasure for us to move into the panel discussion. And we have, again, please do post your questions in the Q&A box and introduce yourselves in the chat, as well as adding your reasons for being here. We have fantastic reasons so far, and we've got great representation from all over the world. I am now happy to introduce our panel, and it happens to be a very Latin American panel, which is great, but of people who are actually global experts working in Latin America and around the world. First, we have Dr. Luz Maria de Brejil, who is the director of the Department of Nutrition and Food Safety at the World Health Organization. She is an epidemiologist with 20 years of experience in the public, private, not-for-profit, and intergovernmental sectors. Then we have Camila Corbalan, who is professor in the Public Nutrition Unit of the Institute of Nutrition and Food Technology of the University of Chile. She was trained as a surgeon, and we love doctors who also embrace public health and become holistic champions and leaders. She is also the director of the Center for Research in Food Environments and Prevention of Chronic Diseases Associated with Nutrition. And she is current chair of the Latin American Society of Nutrition, SLAN. Mauro Brero is UNICEF's senior advisor for food systems for children and the prevention of childhood overweight and obesity at UNICEF headquarters, bringing over 20 years of experience in public health nutrition across Africa, Latin America, and globally. So it is my great pleasure to introduce each of you and to say hello, and thank you for being here. And I think my first question is for each of you, if you could tell me a little bit about what is driving these trends that we're seeing in the Atlas. And again, I'm going to ask each of you to do this. And so, Luz, could you tell us a little bit about health systems readiness and where we are in that in terms of addressing childhood obesity? Is that effective and prepared? Is that being an effective tool?
Hello, everyone. First, congratulations on the report. I think that it brings data that is refreshing and, as you said, also concerning. So I think that as we go through it, there is a lot for us to reflect. And clearly, it says that the health systems are not ready for managing obesity in children. First, screening, managing, and addressing obesity in children in a comprehensive way. I think that Mauro and Camila will talk about it. We have focused a lot of our interventions mostly on the prevention side, on addressing and improving food environments to ensure that diets are healthier. We are seeing progress, but probably we are not there. But in terms of the healthcare, we really have not paid attention to it. We have seen that recent medications have brought a lot of attention to obesity, but in adults. And what we have to make sure is that that attention doesn't preclude us from acting also on creating services that can help children. We need to talk to pediatricians. We need to make sure that primary health care is readier, that our standards are implemented for weight are implemented. And I don't know if it's too early, but I will just share that probably I hope that by the end of the month, WHO will be able to launch two guidelines, one for the treatment of, for the management and treatment of obesity in children and the other in adolescents. These were done by two separate panels, but I guess they reached similar conclusions because the determinant factors are very similar. So these guidelines have a series of recommendations that go from dietary treatment, physical activity, digital interventions, behavior change, and so on. So I hope that by the end of the month, we will make them available and can be a great complement to all the resources that you have put forward.
Thank you very much, Luz. We're very excited for the WHO guidelines to come out. It's been a labor of love and great work and effort on the part of lots of our colleagues and friends in the childhood obesity community. I want to make one quick observation before we moving over to Mar Obrero, which is that in the last year there was a UN meeting on non-communicable diseases, and our one of our major advocacy efforts was to include the word obesity in an incredibly long list of non-communicable diseases that should be addressed in primary care. And again, that means as much as anything, monitoring, surveillance, and at that sort of earliest level. We did not succeed in getting that word included, and I think that speaks to how urgent it is that we understand that having obesity discussed in the earliest stages of a child's life, overweight and obesity is really about is a societal response to a challenge, and one that I think the WHO guidelines are recognizing that if we have integrated health systems sitting alongside nutrition, alongside the wider environments, we have greater likelihood of being successful, and that could really be a game changer. And we hope that is something that we can change. So now, Mauro, last year, UNICEF produced a very startling report that really captured, I think, global attention to this issue. Could you tell us a bit about that report and speak to some of the drivers that you're seeing of what we're seeing then again in the Atlas?
Sure, and thank you, Joanna, and good morning, good afternoon, and good evening to everyone. It is really a pleasure to join you today at the World Obesity Day. Indeed, the report that UNICEF released last year in September provides also very shocking data, which are actually 100% aligned with the data from the Atlas that were just presented. And one of the most shocking findings is that the face of malnutrition today is changing. Today in the world, there are more children 6 to 19 years old living with obesity than children of the same age living with underweight or thinness. So obesity has become the most prevalent form of malnutrition across the globe. And this report, as well as the atlas that was presented, is challenging some assumption, right? Obesity is not an issue only for high-income countries, but actually we have seen that about 80% of children and adolescents with obesity are living in low and middle-income countries. And it is in these countries where the trends are also increasing at the highest rate. So it is really a global problem, a problem that has already settled at very high level in high-income country, and with low and middle-income country, unfortunately, catching up quickly. And if we look at the driver of this crisis, the main driver is unhealthy diets. Unfortunately, children everywhere in the world today are increasingly consuming more and more unhealthy foods, some actually products that cannot even be defined foods because they are very low in nutrients like fiber, vitamins, or minerals, and very high in harmful ingredients like sugar, salt, unhealthy fats, and additives. And it is products that are actually engineered to be consumed in excess. And so their raison d'etre is not really to nourish, but to generate profit. And this is why also our report is called Feeding Profit, how food environments are failing children. And the focus is really on food environment, because the other myth that is being challenged is that obesity is an individual responsibility, or unhealthy diets depends on the incapacity or inability of families to feed their children properly, or children to adopt healthy diets. But it is actually not families or children who are failing. It is systems who are failing children and families. Because what we have in the market, what is affordable, what is available, even what is desirable, is determined by forces that shape the environments where children live, learn, and play. And marketing is one of the key forces that has also a very strong impact on driving this unhealthy diet. So as the problem is complex and systemic, what we need is also a complex and systemic and policy response. And this is why in our report, we recommend to implement a two-tier response. So on one side, policies that limit the offer and the consumption of unhealthy foods. There are proven policies like food labeling, food marketing restriction, healthy school environment, etc. The same policies that are recommended in the WHO acceleration plan to stop obesity. And at the same time, we need also to have solutions in place that encourage and promote the supply and demand of healthy and nutritious foods. So incentivizing production of this food, tax exemption, other type of fiscal policies, but also creating models or financial facility that attract investment on foods, so that we align the good for children and the good for profit, because we believe that nutrition can bring both. And maybe to conclude, one of the common issues and the common challenges that most countries facing when they try to develop and implement those policies is the conflict of interest. Because there is a subset of the food and beverage industry, and mainly the ultra-processed food industry, that is driven by the interest of profit from these foods, and which has been identified from policymakers as one of the main barriers for implementing and adopting those policies. So it will be very important also to consider strategies to address this conflict of interest. Thank you.
Thank you very much, Mauro. So I think that Mauro was speaking about solutions coming across a lot of different sectors. And again, it's really been a privilege to work with UNICEF as they have identified how challenging childhood obesity and overweight are, and their implication for longer-term health, and again how important it is to have multiple sectors involved at the very start. And I think to that point, we'd like to hear from Camila now about that multi-sectoral component. How do you see multiple sectors driving the problem, but also becoming the solution? How does a successful framework work that is targeted to this age group? And how have you done that in Latin America, I suppose, with some of the success stories? Thanks.
Yes, thanks, Joanna. Good morning, good afternoon, good night. It's a pleasure to be here in the World Obesity Day. And I want to echo Mauro and Luz that the report is shocking, and it's a great tool, I think, for advocacy, but for research as well, for what are the needs, what we should be targeting and trying to come out with responses. And I think that Luz mentioned a number of aspects that are related to obesity care, and I totally agree. But probably where countries need to be making more efforts, it's probably on the prevention side. And we already know a number of risk factors that are related to obesity, childhood obesity. And I think Mauro mentioned this very clearly. There are different levels. This is acting at the family level. It's happening at the school and the health system, at the overall society system. And what we have learned in Latin America is that we really cannot focus our efforts in one single aspect. We can have very great interventions at the family side or at the school level, but if that is not supported by action at the country level, that success, it's not sustainable over time. So science has been moving forward and trying to suggest very concrete package of actions that we need to be implemented at the country level. Sugar, beverage taxes, ultra-processed food taxes, marketing restrictions, front-of-package label, providing information, making those options that are healthier, more affordable, accessible, more convenient for people rather than those that are unhealthy. And probably probably in the scientific space, what we have been learning in Latin America is that we need to have a very coherent response and a very coordinated response to this complex disease. We cannot just try to target one single aspect. We need to really coordinate this, and we need science to learn how to do that. We also need more research to understand what Mauro was mentioning, how the power of different commercial actors in the system are really influencing what our girls, what our boys, what our adolescents are exposed to. And really, this is a matter of human rights, because in their cases, it's very clear this is not an individual responsibility. We cannot blame kids for what they are eating. Really, this is a matter of the families, of the system, of the whole country, how we will be addressing this very challenging issue. I just want to finally mention that based on the Latin American experience, we also think that all these policies that we are starting to implement, and I just want to give a note of hope, because we are actually starting to show that this works, that it's meaningful. But we also think we need to be more innovative. We need to think much more how these policies can be particularly targeted to children, to adolescents, and particularly to children below 5 years. What kind of things we need to be doing to target particularly this age group that we know is so relevant from a very nutritional and societal perspective. So I would just leave it there, because I think that the report really highlight the need to move forward.
Great. Thank you so much, Camila. And I think again, this is about the world, but there are great models. Latin America has led the way in many activities. So it's really wonderful to hear. And it's one of the many reasons that we'll be having the International Congress on Obesity there in July in Mexico, a chance to amplify where the obesity is, which is very much in middle income countries. I think that's again really, really important reminder. 80% we're hearing from Tim in terms of, and from Mauro in terms of a sort of where children with obesity are, and in terms of the top 10 countries, only one, the United States, is a high income country. The rest are middle income countries. So, India and China, not surprisingly, but, places like Pakistan and Nigeria and, Brazil, Mexico, et cetera. So I want to just have one sort of further question from each of you about kind of building on this. And Luz, I think I would like to start with you. There's the WHO Acceleration Plan on Obesity, which was approved in 2022, really takes, I think, a multi-sectoral and integrated approach, bringing together all the different factors. What is the and I think that we really heard from both Mauro and Camila also how critical that is. It's not my intervention is better than your intervention. It's like our interventions are all needed. How do we fit into a larger picture? What do you think is the WHO success factor over the next year or two in terms of advancing this? And again, we're all really committed to the acceleration plan, to countries adopting it. What is the sort of one thing that should happen and can happen that would really make sure that the acceleration plan is taken up by even more countries and in an even more ambitious way?
I think that it's hard to tell what is the success factor, but I would say two things, if you allow me. The first is that we have a package of interventions. We have a package that is called ACT, to focus on enable environments, in campaigns, and also in transforming health system. And we follow a life cycle approach. So when we are talking about obesity, we have evidence-proven interventions and guidelines behind these interventions. So it's not that we are making it up and trying to explore what might work. We have guidelines, we have experiences from countries, and we have monitoring systems that allow us to see the progress. Perhaps, as I was mentioning before, the weakest component was our working health systems, because we focus a lot on breastfeeding, promotion of breastfeeding, complementary foods in schools, food environments in schools. But we have seen that health systems were behind. So now we are accelerating that work to be able to provide a comprehensive response in that area. And so that's the first success factor, evidence-based interventions. The second, I think, that is a critical mass. And that's what the acceleration plan brings. There are 34 front-runner countries that have gone through 4 phases or are entering into the fourth phase. First is making an effort to decide what are the priority interventions, national advocacy to design their acceleration plans, their national acceleration plans with priority interventions, then entering into workshops, sharing and learning from peers on particular interventions, then establishing their systems, and then moving to scaling up. So we have gone through with these countries through a cycle that allowed us to scale up, but more importantly, to share. And I always say that public health practitioners and regulators often in the countries have a lonely journey. Civil society is supporting, but there is no, we have built a community of practice because there is no way of exchanging experiences and supporting each other. When we know the challenges that, for example, Camila and other colleagues in Latin America have faced to address commercial determinants, the message is it is possible to go through it and also do it in other places. So this peer-to-peer community of practice and to share lessons and do's and don'ts on both ends is a critical success factor.
Great, thank you. And we're just going to have we have 3 more minutes. So Mauro and Camila, I'm going to ask you, each of you, a question that is coming from the Q&A box. Thank you for those. One is regarding countries where there's large rural communities that are financially challenged. What is your advice to fight cheap food? So if that's what's available, and that's certainly what's affordable, how do we address that? What is aside from upstream policy pieces, what are some other sort of factors we can address? Ways to sort of avoid fighting cheap, sort of addressing cheap food. So Mauro, I'm gonna ask you. You've taken your
Sure.
microphone
Thank you.
off.
Very briefly, I think it is important in low-income countries where these cheap unhealthy food are spreading. It is important on one side, of course, to work to strengthen the existing food standards, regulation, and policies. But at the same time, it is very important to attract investment in local companies that are manufacturing minimally processed foods that are actually adhering to this high safety, quality, composition, and labeling and promotion standards. And in UNICEF, we are promoting an initiative called First Foods Africa, where basically we are using financing facilities and promoting investment to local companies, so Africa-owned companies, to support them to expand their market of this kind of minimally processed foods. And we only work with companies which core business is not ultra-processed food and which are committed not only to healthy food, but also to addressing some of the missing food groups in those countries. So I believe attractive investment and policies that incentivize local production are an important response. Over.
Great, thank you. I want to also note something that that was posted in the chat, and I think is relevant to this as well as to what Luz was talking about. The World Obesity Federation has the MAPS project. It's our second phase of this. It's a 3-year project to really map out where obesity sits in different systems in different countries, which is incredibly important if we are to start to effectively support integrated approaches to obesity. Does it sit mostly in the food system, but not sufficiently in the health system, as Luz was saying, has been the case often with childhood obesity, or too much in the education system without also sort of involving other systems? Does it sit too much in the only in the health system at the expense of other systems? And so what are ways that better understanding of that is critical? And so please do come to our website, and there's a link in the chat for completing the surveys. We've had fantastic responses globally to the surveys, but the more information we have, the better we can plan. So Camila, I'm going to ask you the last question, which is, I hope one that you would have some views on, which is, what do you see? Are there possibilities for the Codex to adopt the ultra-processed framework?
Well,
That's an easy question. Yes or no? So, sorry. Do you have an hour?
Yeah, we're running out of time. I'm happy to discuss that. I think there are options. We have made suggestions. I just want to emphasize that, as Mauro was mentioning, there are possibilities. I mean, the trends we are observing, we can reverse those. I think that's a key message. And I think we have the possibility of doing that. Here, we have 300 people. We can work together. The way forward is work collaboratively. We need to work together. Everyone in each space has the possibility of contribute to this. We need to be very clear about what's the message for the community, for families. We need to push our policymakers to adapt and be creating this facilitating environment. We need to monitor, we need to act, and it's our responsibility, individual responsibility, to actually be active about this. So just giving a note of hope. This is not very far away from us. It's in each of us, in each of our space, to start to create the narrative, the urgency, the need for action, and to request those who are in power to actually provide our girls, boys, adolescents a better food environment for decreasing these trends. So just a note of hope that this is doable, and we are starting to observe some success. So it's in each of us.
Inspiring words. Thank you. And that's with that, I'm going to thank our panel. That was really, really fantastic. And again, yes, what we are reporting in I hope the shock of the Atlas, of the UNICEF report last year, of other things that we're seeing, will wake us up to, we have really got to act together, galvanize action, because it is not destiny. It is a path that we're on that we can change. The ingredients are all there. There's lots of reasons to know that we can change the trajectory of this, but we have to work together. So thank you so much. I want to thank our panel. Great work. And with this, I'm going to turn over to part 2 facilitator, Maggie Wetzel. Thank you, Maggie.
Thank you, everyone, and welcome, and good morning, good afternoon. So without further ado, I want to welcome some country representatives. We're really honored to hear from how this is being championed at country level. We've heard from Luz and from Mauro how there's lots of countries advancing and at different stages. So we have representatives from Egypt, from Brunei, from Portugal, and then a video from Brazil that was sent over. So I'd like to ask perhaps first Dr. Galal El-Hashini. He is the head of the Central Administration for Healthcare Quality of the Ministry of Public Health in Egypt. I'd like to start with you. Perhaps we heard at the Global Obesity Forum that representatives from Egypt were able to attend in New York last year, that childhood obesity is a priority for Egypt. And can you tell us a little bit about the multi-sectoral efforts underway to address obesity and any progress that you have made? Thank you.
Thank you so much. Hello, distinguished guests and colleagues and leaders. Let me say that Egypt today is having obesity as a national priority, and we are backing that up real commitment, policy change, and action on the ground. And let me walk through what we have been doing in the last period. By the start, we look at what inaction was actually costing us. Before anything, we need to understand the economic reality, when to add up the true cost of obesity and to hit workforce productivity, the pressure on healthcare resources and its role in driving diabetes, hypertension, and cancer. The numbers were tracked around 150 deaths annually linked to obesity, and roughly 18 of all estimated deaths in 2020. The burden in terms of dialysis have reached 4 million in the same year, and the economic cost for treating obesity-related diseases in adult runs to around 62 billion Egyptian pound annually. Once we had this picture, political support followed, and Egypt, with the political will, things were moved. After that, we put the right laws and strategies in place. Egypt's response was not a scattered set of programs. It builds a proper legal and strategic foundations, one designed to outlast any single government. We have introduced restrictions on trans fatty acids, removing one of the most damaging ingredients from the food supply. We have adopted the National Nutrition Strategy and the National Health Strategy that treat obesity prevention as a shared responsibility across government sectors. And right now, sugar-sweetened beverage taxation is under the active parliamentary review, a measure that, once passed, did generally shift the people choose to drink. After that, the Egypt most effective tool has been the presidential initiatives model, the largest national coordinated campaigns that reach people where they are, not just in clinics. Through the presidential initiatives of early detection and the treatment of malnutrition diseases among school children, we screened millions of children across Egypt governorates. Around 11 million school children are tested annually, checking their weight, height, hemoglobin, and metabolic markers, and connected this risk not only for screening but also to treatment. The result was documented childhood malnutrition and obesity-related disease prevalence has been dropped from 13% in 2090 to 8% in 2025. This is a real measurable change achieved in 6 years through consistent work, not only by Ministry of Health and Population, but as a multi-sectorial with collaboration with other ministries and School of Education. And this initiative doesn't sit in isolation. Obesity screened has been, as a risk factor, moved to the other presidential initiatives under the umbrella of 100 million healthy lives campaigns. And we had screened over 60 million of Egyptians for non-communicable disease, integrating obesity and the metabolic syndrome checks alongside with hypertension and diabetes and liver diseases. Other initiatives for women health include body mass index screening, nutritional counseling, and referral pathway for women living with obesity, and maternal and child health addresses nutritional status during pregnancy and the first 1,000 days of life for the newborn. That window and shapes metabolic health for years to come. The presidential initiatives for cancer early detection as well integrate metabolic risk proofing, recognizing the obesity as a known contributor to multiple cancer types. After that, we got the people moved, and under the personal patronage of His Excellency, the President of the country, the physical activity has become a genuine national priority as well. Mass participation in sports event, investment in community sports facilitation and physical activity built into school curricula that have helped shift in national conversation, making movement and something visible and encouraged and within reach. After that, the media, which has been a mass consistent part of the Egyptian approach to control and manage obesity across different channels like television, radio, even digital platform and social media. We have run a sustained campaigns on healthy eating, the health risks of obesity, and cultural attitudes that can move excess weight, it seems normal. And we try to be timely about right now as millions of Egyptian families adjust their eating during the holy month Ramadan. We have launched a targeted campaign across all the channels addressing the spike in sugar consumption during Ramadan as a tradition that can bring these messages is a straightforward and culturally aware and elevate to reduce sugar and to protect health this Ramadan and after as well. This that was responded as a public health look like meeting people where they are when it meets. And here from Egypt, the legal reform is starting from the large scale screening to physical policy to Ramadan media campaigns. Egypt is showing that a comprehensive cross-sector political supported responses to obesity that can work, and it's producing results. Childhood diseases prevalence down by third, tens of millions screened, harmful fats restricted by law, sugar taxation in progress, physical activity embedded in a national life, And actually, I'm not sharing this to claim that we have solved everything. The challenge is still real, and we have a long way to go. We are sharing it because it's a coalition existing for exactly that kind of exchange. So what can work in Cairo, we can inform that it can happen in Amman, Nairobi, Jakarta, and maybe other places. Thank you.
Thank you so much. That has been very comprehensive and quite inspiring. I'd like to turn over to Dr. Alice Young Moy Ling she is the lead of the Obesity Task Force at the Brunei Darussalam Ministry of Health. Dr. Alice.
Thank you. Good evening, everyone, and thank you for inviting me to share Brunei's experience and efforts in tackling obesity. So obesity, as we know worldwide, remains, and certainly so in Brunei, is certainly one of the most pressing public health challenges that we are currently facing. Our data from the Global School Health Students Survey shows that amongst the adolescents aged 13 to 17, nearly 20%, actually 80.1% are obese, and over a third are overweight. These figures are very discerning and very worrying, because we all know that this excess weight in the children and adolescents will lead to complications of obesity and NCDs as they grow up. So the adults are very much the same figures that we're seeing, whereby our latest STEP survey shows that that was published just last year, shows that 2/3 of the adults are either overweight or obese, and a third of us are living with obesity. With these figures, it is obviously alarming for everyone, and has encouraged Brunei to establish, our Ministry of Health, to establish the Obesity Task Force, and this was set up in 2024. I actually joined Obesity Task Force as the chair due to my work with obesity as an endocrinologist. So I'm a clinician, really, full-time clinician. So our aim of this Obesity Task Force in Brunei is to coordinate the policies, the programs, and to engage the stakeholders across sectors. So we have put in efforts into two main areas. One is to prevent obesity from increasing in the adolescents age groups, preventing it in school. And secondly, we're strengthening primary health care. So in the school, we know that for children, it's a critical time to ensure that they understand better habits, and this time they can learn to live with understanding better nutrition and exercise. So one of the initiatives that the Ministry of Health has done is to start the Health Promoting School program, and this is in collaboration with the Ministry of Education. We piloted it by going to selected schools, both governmental and private schools. And what we've done is we've empower the schools in order to run initiatives whereby they can implement comprehensive health promotion initiatives. This is obviously done with assistance from a health promotion center. So this includes healthy eating habits, and it also includes a healthy eating environment within the school, obviously adhering to guidelines that we've set up for tuck shops, as we call it, or school canteens, and also to promote regular exercise. This is not just for students, but we're also working for and together with the teachers and staff of all the schools. So ultimately, what we feel is that if we can work closely with these educators, we can create an environment where a healthy choice is an easy choice. Our second focus, as I've mentioned earlier, is to strengthen primary health care. So with primary health care, what we've done is we've worked very closely with WHO as part of the acceleration plan, and we have actually started to integrate the prevention of overweight and obesity and management into the healthcare system across all across the whole lifespan. So I just want to touch upon prenatal care, postnatal care, and of course, children. So what we've done is we have involved, together with WHO, we've run a train-the-trainers workshop whereby we have trained and upskilled a cadre of healthcare workers in order to support us. What we are aiming is for them to be able to train and to go out and train more staff in order to monitor growth in the children. We've also mandated that BMI is going to be measured across all clinics and all services in order to be able to pick up and assess obesity and overweight. And together with this, we've worked on a structured referral system to ensure early access to care. So in Brunei Darussalam, our journey is just beginning, but we're very committed. And we also feel that by working together, not just as governmental agencies, but with schools, families, communities, and healthcare workers, we're able to create an environment in which our children can have a healthier future. Thank you.
Thank you so much, Dr. Alice. This is very encouraging to hear how you've involved so many sectors. And next, I would like to ask Maria João Gregorio. She's the director of the National Healthy Eating Promotion Program in Portugal. Welcome. So what about Portugal's efforts in this area? How are you collaborating and integrating all this work?
Many thanks, Maggie, for the question and for inviting Portugal to take part in this celebration of the World Obesity Day. And I would like to congratulate the World Obesity Federation for the excellent work in raising awareness and placing obesity high on the global agenda. And in Portugal, obesity prevention and management has been a priority within our national health strategy. And we have been implementing a comprehensive and multi-sectoral approach that combines health systems interventions, public health policies, and also actions across different sectors, in particular education and also agriculture, because we know that if we would like to really prevent obesity, we need to act beyond the health sector. And on the prevention side, Portugal has implemented several population level measures to promote healthier food environments, and these include fiscal policies such as the tax on sugar sweetened beverages, improvements in school environments, reformulation agreements with the food industry and with the retailer sector, and also measures to regulate food marketing to children. And at the same time, we have been strengthening health literacy and promoting healthier dietary patterns and physical activity across the population. And within the health system, we are working now to improve the early identification and also the clinical management of obesity, trying to implement a new model of care across all the levels of care, but trying to, in particular, integrating obesity care within our primary health care, and also promoting multidisciplinary approach to manage obesity. And I would like to say also, because Portugal is one of the countries that are integrating the WHO acceleration plan to stop obesity. So I'd like to say that the WHO acceleration plan to stop obesity has been very valuable in supporting and accelerating our work. It helped reinforce political commitment, promote coordination across sectors, and provide a structured framework to scale up effective policies and interventions. And also this platform of countries also facilitated exchange of best practices with other countries and support the alignment of national actions with the global priorities. So overall, it has contributed to strengthening the Portugal's capacity to move faster and more strategically in addressing obesity as a complex public health challenge. Thank you so much for this opportunity.
Thank you so much, Maria João, and congratulations to all the governments that have just shared their experiences. I disagree that you're at the beginning of the journey. I think that you're all quite on your way. To complement these perspectives, the government from Brazil has sent us a video that we'd like to play for you because unfortunately they weren't able to join us. If you'd like to play this, and then we'll move on to our next panel.
Olá, eu sou Kelly Alves, atual coordenadora geral de alimentação e nutrição do Ministério da Saúde do Brasil. Gostaria de agradecer pela oportunidade de contribuir para esse evento de mobilização pelo Dia Mundial da Obesidade 2026, que tem como tema a prevenção da obesidade na infância. Atualmente, no Ministério da Saúde do Brasil, nós trabalhamos a partir da compreensão de que a proteção da saúde na infância demanda um conjunto amplo de ações que sejam de duplo impacto, ou seja, que ao mesmo tempo contribuam para a prevenção das múltiplas formas de malnutrição, que incluem tanto o excesso de peso e a obesidade, quanto a desnutrição e as carências de micronutrientes específicos. Essas diferentes formas de malnutrição, que à primeira vista parecem simplesmente antagônicas, na verdade possuem determinantes sinérgicos, que são fatores biológicos, ambientais, econômicos, sociais, ambientais e culturais, que ao mesmo tempo podem levar uma mesma criança a desenvolver obesidade, déficit de estatura e anemia, por exemplo. Entre as ações que priorizamos no nosso país e que são capazes de prevenir a obesidade e as outras formas de malnutrição na infância, nós destacamos a promoção e proteção da amamentação. Nesse sentido, nós celebramos a aprovação da resolução sobre a regulação do marketing digital de produtos substitutos do leite humano na última Assembleia Mundial da Saúde em 2025. A partir do protagonismo do Brasil em parceria com o México, e reforçamos o nosso compromisso para a implementação dessa medida no Brasil. Outro grande investimento no nosso país tem sido a ampliação e a qualificação das equipes de atenção primária à saúde. Hoje são cerca de 55 mil equipes atuando nas 5.570 cidades do nosso país. Essas cidades recebem tanto apoio financeiro quanto técnico do Ministério da Saúde para qualificar as práticas dos seus profissionais, incluindo as práticas de atenção à saúde das crianças, entre elas o monitoramento do crescimento e desenvolvimento infantil, a orientação alimentar, o estímulo à atividade física, além da articulação intersetorial nos territórios, especialmente com as escolas. E mais recentemente, destacamos que o Ministério da Saúde se uniu a outros 13 ministérios de diferentes setores em uma estratégia intersetorial de prevenção da obesidade, composta por cerca de 90 ações e compromissos em eixos estratégicos a serem implementadas na década de 2025 a 2035. Por fim, ressalto também que temos atuado para a prevenção do estigma do peso e da gordofobia no nosso Sistema Único de Saúde, buscando promover um melhor acolhimento e respeito às pessoas que vivem com obesidade nos serviços de saúde. Mais uma vez, agradeço a oportunidade de participar desse evento, compartilhando as nossas ações e nos coloco à disposição para as novas cooperações. Obrigada.
That was great. Thank you so much to Brazil. And here we are with our next panelists. Here we have some civil society representation for all of you. So I would like to welcome, let me find over here, Kim Yoo-hin. She's a family physician and chair of the Healthy Together Social Cooperative, an obesity advocacy organization based in Korea. We also have Brina Narmuch. She is representing youth from Slovenia. She's a UNICEF Junior Ambassador and youth advocate, passionate about creating a healthier food environment. And lastly, we have Lisa Mandel. She's a global advocacy advisor, International Lactation Consultant Association, and a partner of the Global Breastfeeding Collective. Welcome to all of you. I would like to start perhaps with Brina. Brina, what is the importance of youth activism in addressing childhood obesity? What's been your experience in Slovenia? I know you're involved in the Fix My Food campaign. Would you like to tell us a bit about that?
Yes, thank you. Thank you very much for inviting me. And good afternoon, good morning, good evening to everyone. I would like to emphasize that young people have incredible power to drive real, lasting change. And we are here to prove it. Across the globe, youth are organizing, raising their voices, and taking bold action to build food systems that are healthier, fairer, and built for everyone. Obesity is a challenge that affects us all. It is not simply a matter of personal choice. It's a complex global issue that hits closest to home for children and young people, and we refuse to stand by while it goes unaddressed. The information we receive shapes the choices we make. Imagine trying to explain to a young child why a product is harmful when all they see are bright colors and friendly cartoon characters on sugary, ultra processed food packaging. Our youngest community members deserve better, and we have a collective responsibility to protect them. Yet, far too often, they are the primary targets of aggressive food marketing. It's time to put public health before profit, and young people are leading that charge. Because the reality is, we cannot escape the food noise. Ads follow us everywhere, on buses, on streets, on buildings. High school neighborhoods and typical school neighborhoods are filled with tempting meal deals, irresistible smells. Making genuinely healthy choices is really hard when every environment is trying to pull us into a different direction. We believe that young people and old people deserve a food environment that supports their well being, not one that works against it. And this is personal for us too. As a young athlete myself, I genuinely try to make healthy choices every day. But in the rush of daily life, checking every ingredient is not always realistic. Too often, I have to rely on food labels. And too often, those are misleading. And this has to change. Healthy food should be accessible, clearly labeled, and affordable, not hidden away or priced out of reach. Expecting young people to decode every additive and ingredient on their own, I believe, is simply not fair. And this goes beyond young people. Older adults managing conditions like diabetes also depend on clear and accurate nutritional information to stay safe. When ingredients are printed in fonts so small they are barely readable, it's not just frustrating, it's a public health problem. Transparent, standardized food labeling is something every person deserves, regardless of age. And this is exactly why we believe youth voices belong in these conversations. We see it as a matter of basic fairness that food corporations should not be able to determine what is available to our communities without regard for our health. Children's bodies are more sensitive to certain ingredients, and many widely available products do not meet the recommended dietary guidelines for young people. So, when youth are at the table, the right questions get asked and the right priorities get set. But here's the exciting part: we are not just talking about change, we are already making it happen. In Slovenia, we launched the Fix My Food Slovenia campaign, part of the global Fix My Food movement, dedicated to achieving real systemic change across our food environment. We are a passionate group of young people from across Slovenia, and we have already brought our policy directly to the Ministry of Health in Slovenia. But our campaign went even further. We wanted to share our concerns and our voices throughout the country in order to engage more young people and the general public, and to keep those issues on the government's agenda. Our group has now become a community, and we will not stop calling for the changes that need to happen. The food environment should protect our health, not the other way around. And we are growing, we are motivated, and we are just getting started. Because this is only the beginning. Our goal is a future where nutritious food is available to everyone, no matter their income, their background, or the country they call home. And that future is possible. And together, I believe we are going to build it. Thanks again so much for inviting me and giving me the opportunity to speak here today. Thank you.
That has been great. And thank you, Brina, and all of you for, well, keeping us all accountable, I think. I'd like to turn over to Kim. Kim, what is the importance of working with experts by lived experience in ensuring impactful action? Would you tell us a little bit about your journey?
I want to introduce myself again. Oh, can you hear me? Yeah. I'm a family medicine physician and also a founder of Healthy Together Social Cooperative, which is a obesity advocacy group, which started as a obesity anonymous self-help group. I started the self-help group at 2013, and it evolved to make more change and advocacy in the front. To do that, we began a social cooperative. Actually, in South Korea, we are just beginning to hear about lived experience voices. So I'm very thankful to World Obesity Federation to giving a chance to tell our story. I want to, can you show my slide, please? This is a slide. If you see this slide, we usually think it's like a very successful story about weight loss. But I want to tell you a story why lived experience matters. I lost like 35 kilograms by exercising and eating well. I also got a certification for training and sports program. However, that time I couldn't attend the public obesity management program. It was built on high intensity interval training, which is right now, until now, is like promoted as the most effective way to exercise. But it was too straining for my ankles and wrist and knees, so I couldn't finish the program. But usually if the public program, those managers think like, oh, those who are chubby, fat, they are very lack of will. They couldn't finish the program. But the obesity management program isn't built for obesity with the higher weight, because it's just about calorie expenditure. So I think experience like this shows why lived experience matters, and research and policies should reflect the realities that we face. And especially if you don't hear the voices of lived experience, they unintentionally push the patients away instead of supporting them. Next slide, please. And also, I want to show this picture because the picture on the left is the first time I realized about my weight. I was called fat. And after that time, I was very conscious of my weight, and I tried a lot of weight management like starving or one food diet, Denmark diet, every kind of thing, exercising, but it all failed. And I want to say what obesity treatment, especially in the childhood, means. Right now, my comfortable weight is 100 kilograms. My set point is 100 kilogram and higher, BMI higher than 35. If the obesity disease and obesity treatment was introduced, and if I was educated about that, maybe I could have stopped at 80 kilograms. It would have been very big difference right now. And also, when I get older, I would have different risk of comorbidities. So I want to emphasize that I understand obesity prevention is very important, especially for the general public, but the perfect obesity prevention program doesn't treat people already living with obesity. So obesity treatment, cure must be always on the talk. And so I'm very thankful for inviting me to be on this panel. And I want to thank, I believe that if we truly want to change the future of obesity, we must listen to people living with obesity. Thank you.
Thank you. Thank you so much, Kim. Thank you for that. I'd like to turn over to Lisa. Lisa, what do you see the role of breastfeeding promotion be in addressing obesity? Would you like to tell us a bit about the Breastfeeding Collective?
Sure, thank you. And thanks so much for having me and for including breastfeeding in the important work that you're doing. First, I'd like to just point out that today, in addition to being World Obesity Day, is also IBCLC Day, which celebrates the important role of international board-certified lactation consultants in supporting breastfeeding. I think this coincidence really highlights the synergy between breastfeeding and reducing obesity. But the first thing that I would like to address is the growing body of literature that demonstrates the significant impact of breastfeeding in reducing the odds of developing obesity from childhood into and through adulthood. So, for example, a systematic review from Horta showed a huge 37% reduction in odds among children 10 to 19 years old, reduction in the odds of developing obesity. So this is 10 or more years after the introduction of other foods besides breast milk. And that reduction in odds continues for adults 20 and over. They see a 12% reduction in odds. So the data is really significant. And I entered in the chat a bunch of these links. So if you want to get more information, you're welcome to. There are several ways that breastfeeding might have an impact. The hormones in breast milk, including leptin, can help regulate metabolism and satiety. Breastfeeding protects against excessive weight gain in the first year of life, which we know impacts later childhood obesity. And breastfed babies self-regulate their caloric intake, whereas parents who are bottle feeding sometimes push to finish the bottle, again, leading to more overweight. And research is continuing in all of these areas to help identify and clarify these processes. One more research point I would like to bring up is the cost of not breastfeeding tool, which identified that nearly 100,000 cases of childhood obesity could be avoided each year just by breastfeeding in line with global recommendations. So that gives us a little background on how breastfeeding impacts obesity. I am here as a representative of the Global Breastfeeding Collective, which is a partnership of 26 international agencies led by WHO and UNICEF. Together, this group calls on donors, policymakers, and civil society to increase investment in breastfeeding worldwide. So we feel that by bringing together many organizations working in breastfeeding, we're able to unify advocacy messages so we are disseminating coordinated communications for maximum impact. Some examples, we've created social media campaigns, webinars, we have advocacy briefs on key policy issues, including one on breastfeeding and the prevention of overweight in children. And the partners of the collective use these resources in their advocacy work. Again, so we're speaking with the same message. A very important aspect of our work is we've collated resources on the collective's website, and I'll enter that in the chat after I'm done speaking. into a toolkit that makes it easy for advocates to find the essential documents from WHO, UNICEF, and our partners around breastfeeding support. And that toolkit can be searched by topic, so it's very easy to find resources on the different policy actions. Another important thing the collective does is we have developed the Global Breastfeeding Scorecard. This is an online interactive tool that tracks progress on 7 policy actions and on breastfeeding actions and practices within countries. It's updated annually, and a downloadable report is also available on the website. So the Global Breastfeeding Collective has a number of policy actions. One is focused on advocating for the regulation of marketing of commercial milk formula, which of course is linked to the broader issue of marketing of unhealthy foods for children. Formula is the first ultra-processed food consumed and has significant negative health impacts. The International Code of Marketing Breast Milk Substitutes was enacted 45 years ago, perhaps one of the earliest efforts to regulate marketing, and may serve as a good resource for other regulation efforts. Because we understand the importance of an enabling environment, we also advocate for paid maternity leave, for strengthening health systems by providing breastfeeding-friendly health and maternity services, and that includes skilled breastfeeding counseling and support, and a number of other policy actions as well. Most of the work we do is done by the members of the partner organizations. We do have a secretariat to help organize and coordinate our work, but again, much of the work is done by the partners ourselves. And many of these policy actions provide opportunities to network with other NGOs whose focus may be outside of infant feeding, but where there are important connections, such as this opportunity to work with the World Obesity Federation. We've found that working together can really increase our impact. So thank you very much again for having us.
Thank you. Thank you so much. And it was great to hear how both of you, from quite different perspectives, you were both advocating for giving children their best start, which is, of course, part of the World Obesity Day theme this year. Before we move on to our president, Dr. Simone Barker, I would like to ask you, Kim and Lisa, what is your reason for acting on obesity?
Should I start? Yeah, my reason for acting on obesity is I want to be a grown-up that I needed when I was young. Especially I'm in a special position that I am an expert who has a disease that could be building a gap, translating the patient's voice to be heard to the doctors, and also the doctors' language is very hard. So I think I could translate their expression to who could like touch the obesity disease as a different angle. So it's like my dream that I needed someone when I was young, and I think I'm doing it very vigorously.
Thank you. Thank you.
And for me, I will reiterate what I ended with, that supporting this call to action is really a great opportunity to ensure that supporting breastfeeding as one step in reducing obesity is included in policies. And I'm so glad to see that you're already doing that. Thank you.
Thank you both, and thank you for all your panelists and our government panelists today. And on to Simone.
Thank you, Maggie. Thank you for this wonderful seminar to Joanna and you, and good morning, good evening, and good afternoon to everyone. As we bring this seminar of World Obesity Day 2026 to a close, I want to thank each of you for your contributions today. Throughout this symposium, one truth has become clear: and it's that reversing the obesity epidemic requires a systemic transformation. For too long, we have relied in a reductionist narrative that incorrectly places the blame solely on individual choices. But today, we recognize obesity for what it truly is, a complex chronic disease driven by our environments, biology, and commercial determinants. To change this trajectory, we must establish a common vision, one that places public health, human rights, and sustainable health environments at the center of our societies. However, a vision alone is not enough. The sheer scale of this public health challenge requires multi-sectoral collaborations. The success of our strategies depend entirely on untying the efforts of governments, the healthcare sector, academia, and civil society. No single entity can solve this alone. We must bring our diverse perspective together to protect our policies from conflicts of interest and to build environments where the healthiest choice is the easiest choice. Finally, our vision and collaboration must be sustained by robust capacity building. Transforming our health systems means we must actively empower our frontline health professionals, educators, and communities. By updating academia curricula, providing continuous training, and equipping our primary care healthcare systems with standardized evidence-based protocols, we can ensure that obesity is prevented, diagnosed, and managed comprehensively and compassionately, completely free from stigma. We are looking at a future where 4 billion people could be living with overweight or obesity by the year 2035. Let the World Obesity Day serve not just as a reflection of those numbers, but as a catalyst for immediate action. We have scientific evidence, we have strategies, and together we have the power to change the story. Let us live here today, united in a common vision, strengthened in our collaboration, and committed to building the capacity needed for healthier and a fairer world. Thank you very much. Thank you, Maggie.